Hi, my name is Dr. Aman. I'm one of the consultant pediatric neurologists at Neuropedia. Today we are starting a first of its series of the talks called Infocus from Neuropedia, where we'll focus on various these pediatric neurology disorders which we come across in Neuropedia. I'm going to talk about myths about epilepsy today in Infocus. Epilepsy is something which is unfortunately still a big taboo in the world. However, when it is dealt with properly by child neurologists or trained child neurologists, it is very easy to deal with, as well as we have good outcomes in those children. So let's talk about what is epilepsy to begin with. Epilepsy merely means tendency to have seizures. Now I get asked this question very regularly: what are seizures? So a seizure is something which happens because of sudden burst of abnormal electric activity in your brain. Imagine a brain as a transformer, and then suddenly there's a burst of abnormal electricity that leads to something called a seizure. And if you have more than one seizure, it is called epilepsy. Epilepsy is something which is very common in the world. In UK, we say approximately 1 in 100 people have epilepsy. And approximately on a daily basis, there are about 87 people who get diagnosed with this condition. The second question which I get asked very commonly is, what causes epilepsy? Now, half of the patients or half of the population which I see in my clinic, we don't know why epilepsy happens. We think it's genetic in nature, but we don't know all the genes yet. And then there are other causes. For example, in children, very common cause is structural abnormality, or if there is a lack of oxygen supply to the brain when the child is born. These are very common causes of epilepsy in children. Then you may have some nasty disorders like tumors or stroke, and fortunately these are not a huge proportion of children in which epilepsy occurs. I also get asked very commonly that, doctor, how can we diagnose epilepsy? And very commonly they say, let's do EEG to diagnose epilepsy. Unfortunately, that's a big myth. EEG is not there to diagnose epilepsy, it's only there to help us in the diagnosis. In vast majority of children, we may have a normal EEG, yet they have epilepsy. So how is epilepsy diagnosed? Well, it's diagnosed on a proper history which a child neurologist takes, as well as the video which the parents bring to us. So as a parent, I would advise to get that video of the child who's having a seizure. It will help us to diagnose epilepsy. Finally, I do get asked, is it curable? Well, I wouldn't say it's curable as such, but it is treatable. Epilepsies, by definition, as the child grows up, many of them tend to burn out. So our job as clinicians is to ensure that the child gets proper medication so that the epilepsy is under control, and as the brain matures of the child, the epilepsy will slowly burn down. So in summary, epilepsy is something which is easily treatable and can be diagnosed in the hands of a good child neurologist, and I would suggest when it is diagnosed early, the outcomes are really good. Thank you very much.